Many of you continue to reach out to us with questions about the coronavirus. So many questions are lingering, and so Dr. Mallika Marshall joins us now, always answering our questions. And we begin with Cindy, who writes, I am on day 9 after testing and being sick from COVID. Am I still contagious?
Well, if you're still testing positive 10 days after the onset of your COVID symptoms, it's certainly possible that you're still infectious, although we're not exactly sure. But I would say probably still not a good idea to be around people who are high risk, just in case you could pass the virus on to other people. It's also important to remember that those who are immunocompromised or people who get severe COVID actually might be infectious for a longer period of time, up to 20 days. So they have to take precautions for longer.
There's an anonymous viewer who writes, my wife and I are thinking about visiting family and recently found out that they have not been vaccinated. I'm 83 years old with some cardiac issues. Should we see them?
You know, that's a good question. Before we would say probably not. And we know that people who are unvaccinated are at greater risk of getting infected than people who have been fully vaccinated. But as we know, plenty of fully vaccinated people can get COVID as well. So I think what's most important is that you and your wife are completely up to date on your COVID boosters, including the most recent bivalent Omicron booster. You could also ask family members to test the day that you're arriving, just to be cautious. And then if you develop symptoms, make sure you test right away, because you definitely want to make sure you fall within that window of when you can get medication to try to prevent you from getting severe COVID.
Right. We still have those moments we're navigating. It's tough. Keith asks, 1 year after having COVID, I have yet to consume even 1 or 2 beers or wine for fear of messing up the antibodies. I have heard alcohol drinks can lower one's immunity, though. True?
Well, it's unlikely that light drinking or even moderate drinking is going to have a significant impact on your immunity. But again, more importantly, I would make sure that you stay up to date on all of those boosters. And again, everyone 12 and up should get the most recent Omicron booster. So you can talk to your doctor for more guidance, but just stay up to date on your boosters.
Right. If you're going to go get your flu shot, you can get both.
You can get both on the same day.
Craig writes, is it helpful to use mouthwash regularly to prevent COVID, since it says it can kill 99% of germs? Good question.
I know, you would think so. This is actually a really interesting question. First of all, when you contract COVID, it's usually because you've inhaled contaminated respiratory droplets in the air. And so a mouthwash is probably not going to prevent you from getting infected that way. However, if you've been to the dentist during the pandemic, a lot of them are having people swish and spit an iodine solution to try to get rid of any virus in the mouth so that it protects them. And actually, scientists are right now studying both mouthwashes and nasal rinses as ways of trying to protect people from developing severe COVID.
Wow. What do they call them? Neti pots?
Neti pots are for sinus infections, exactly. But they're looking at, they're looking at saline solutions and other concoctions to see if they might help.
So
you're onto something.
You always bring us something new. Dr. Mallika, thank you so much.
You're
and of
welcome.
course, Dr. Mallika offers her best advice. But as always, consult your personal doctor before you make any decisions about your health. If you have a question for Mallika, though, about coronavirus or any other medical issues, here are the 3 ways to reach her. Email drmallika@cbs.com, on Twitter @Mallika Marshall, or Facebook message her, Dr. Mallika Marshall.